Ever thought about those tiny hair-like structures in your body called cilia? They're like the unseen heroes of our bodies, wiggling and jiggling to move stuff around. You can find them in places like your nose, lungs and ears. Their job is to keep things moving, whether it's mucus in the lungs or particles in the ear. They are essential for our health, and when they function normally, we hardly even know they're there. But let's take a moment to imagine what happens when these microscopic movers aren't doing their job as they should be. What if they're not wiggling quite enough, or not at all? Well, that's when we start to encounter some issues. This is the reality for people living with a condition called primary ciliary dyskinesia, or PCD for short. PCD is a rare genetic disorder that affects how the cilia function. It's estimated to occur in about 1 in every 15,000 to 30,000 live births, though these numbers could be an underestimate. The prevalence is hard to pin down, but what we do know is that PCD has a significant impact on those who have it. When someone has PCD, their cilia can't perform their tasks properly. This might not sound like a big deal, but when you consider that one of the cilia's main jobs is to move mucus out of the lungs, you can start to see the problem. Without properly functioning cilia, mucus can build up, leading to breathing problems and infections. So, what happens when these cilia can't wiggle as they should? That's where primary ciliary dyskinesia comes in. Genes, those tiny bits of DNA, play a big role in PCD. They're the blueprint for every part of you, including those tiny hair-like structures we talked about earlier, the cilia. You see, PCD is a genetic disorder, meaning it's passed down from parents to their children through genes. Every person inherits a pair of genes for each trait from their parents, one from mum and one from dad. These genes carry the instructions for every part of our bodies, including the cilia. Now, in people with PCD, the pair of genes that control the functioning of the cilia are abnormal. These faulty genes don't provide the right directions for the cilia to move and function properly. Imagine it like this. You're putting together a complex piece of furniture, but the instructions are wrong. It's going to be tough to assemble it correctly, right? That's what happens to the cilia. The wrong genetic instructions make it difficult for them to do their job. Most of the time, for someone to have PCD, they need to inherit abnormal genes from both parents. If a person only gets one abnormal gene and one normal gene, they won't have PCD. But they become a carrier of the disease, which means they could pass the abnormal gene to their own children. That's why PCD often runs in families. If both parents are carriers of the abnormal gene, their children have a 1 in 4 chance of having PCD. This is known as autosomal recessive inheritance. Understanding the genetic nature of PCD is crucial for researchers in developing targeted treatments and hopefully a cure in the future. It's also important for families to understand their own genetic makeup and potential risks for their children. It's all in the genes, and in the case of PCD, it's about those controlling the cilia. What signals should someone look for if they suspect PCD? It's a question that deserves some attention, because recognizing the symptoms of primary ciliary dyskinesia, or PCD, can be the first step towards getting the right diagnosis and treatment. So, let's delve into the various symptoms of PCD. First off, frequent lung infections. Now, remember those tiny hair-like structures, the cilia we talked about earlier? In PCD, the cilia can't do their job of moving mucus out of the lungs. The mucus gets trapped and becomes a breeding ground for bacteria, leading to frequent infections. Next, breathlessness. It's not the kind of breathlessness you feel after a good workout, but rather a constant struggle for air, even during light activities or at rest. This is because the trapped mucus and infections can block the airways and make it harder to breathe. A persistent cough is another common symptom of PCD. The body tries to cough up the stuck mucus, leading to a cough that just doesn't seem to go away. Alongside this, sinusitis, or inflammation of the sinuses, can be a frequent visitor for someone with PCD, as the cilia that should be clearing mucus from the sinuses are not functioning properly. Now, here's a unique symptom of PCD. Some organs in the body may be mirrored or flipped from their usual position. This is known as situs inversus, and it occurs in about half of the people with PCD. It's one of those fascinating quirks of the human body that can give doctors a clue that something unusual like PCD might be going on. It's important to note that symptoms can vary greatly from person to person. Some people with PCD might start seeing symptoms right from infancy, while others might not notice anything unusual until later in life. There's no one-size-fits-all when it comes to PCD symptoms, so there you have it. Frequent lung infections, breathlessness, a persistent cough, sinusitis, and possibly even organ mirroring. These are some of the common signs that could hint at PCD. But remember, these symptoms can also be associated with other conditions, so it's important to consult with a healthcare professional for a proper diagnosis. Symptoms can vary, but these signs could hint at PCD. Diagnosing PCD is not as straightforward as one might think. The common symptoms of PCD, persistent cough, breathlessness, and frequent lung infections, can often be mistaken for other respiratory illnesses. This makes recognizing PCD quite challenging. However, there are certain techniques that doctors employ to arrive at an accurate diagnosis. One of the primary methods involves taking a sample of the cilia from the nose or the lungs. This is then examined under a microscope to check for abnormalities in their structure or movement. Remember those tiny hair-like structures we talked about earlier? In PCD, they aren't doing their usual dance of moving mucus out of the lungs, so spotting this under the microscope can be a telltale sign of PCD. Another method involves genetic testing. Since PCD is a genetic disorder passed down from both parents to their children, identifying the faulty genes can confirm the diagnosis. This usually involves taking a blood sample and testing it in a lab to look for specific genetic mutations associated with PCD. However, it's important to remember that these tests may not always be conclusive. Some people with PCD may have cilia that appear normal under the microscope, or they may not have the known genetic mutations associated with the disorder. In such cases, doctors might have to rely on the patient's symptoms and medical history to make a diagnosis. But why is diagnosing PCD so crucial? Well, an early diagnosis can significantly improve a patient's quality of life. It allows for better management of symptoms, preventing further lung damage and reducing the risk of severe respiratory infections. It also helps doctors devise a treatment plan that's tailored to the patient's specific needs and condition. So, while diagnosing PCD might seem like looking for a needle in a haystack, it's a vital step in helping those with the disorder lead healthier and more comfortable lives. Early diagnosis of PCD can significantly improve a patient's quality of life. Let's delve into the world of medical imaging for a closer look at PCD. Radiographs and high-resolution computed tomography, or HRCT scans, are key tools that bring the effects of PCD to light. In a chest radiograph, one of the abnormalities they might reveal is bronchiectasis. This condition is characterized by a chronic, irreversible enlargement of the bronchi or bronchioles, typically most severe in the lower lobes of the lungs. Another fascinating abnormality that might show up is situs inversus. This is a condition where the normal organ placement in the body takes on a mirrored image. In fact, about half of the patients with PCD have situs inversus. Now, let's turn our attention to the high-resolution computed tomography, the HRCT scan. This imaging technique can provide a clearer view of bronchiectasis compared to a chest X-ray. It can also show bronchial wall thickening, a result of chronic respiratory infections, inflammation and damage. Moreover, it can reveal mucus plugging and atelectasis, which is a collapse or closure of the lung, often due to recurrent infections. HRCT scans can accurately determine the extent, pattern and severity of airway abnormalities. As the disease progresses, both chest radiographs and HRCT scans could show additional findings related to complications. For instance, a progressive loss of lung parenchyma could lead to a decrease in lung volume. Also, the development of pulmonary hypertension due to chronic hypoxia could be detected. While PCD is a complex disorder, understanding it is the first step towards managing it effectively.